But thank you everyone for coming. My name is Charlie Twig, for those of you who don't know. What I'd like to do is something we often do just to help everyone stay aware of who's who and who you represent. Every now and again we see new faces, and that's really fun. We have some important guests here, but want to have everybody a chance to talk about what they're doing in their roles. So what I'd like to ask is that each of you go around and introduce yourself, talk a little bit about what your role is and your interests with our Community Advisory Council. So I'm Charlie Twait, I'm the hospital CEO here.
I'm Kristen Chatfield. I am one of the guests he was mentioning. So I am based in Bend, but I work for OHSU and specifically for the Oregon Rural Practice-Based Research Network. And I work with both clinics on a heart health project called Healthy Hearts Northwest, and we're doing a touch also for the colorectal cancer screening project. And I am really interested in probably most interested in the food court, but hunger and food security has been one of my research expert pieces. So I'm really interested in that. Oh, and also Outback Strong. I can't wait to hear more.
Good.
My name is Arvind Singh. I'm the chip coordinator at Lake Hill District, Lake County, and I'm the LCAC coordinator too. Nice to see all of you here.
Hi, I'm Alana Chaniak. I'm with the Eastern Oregon Healthy Living Alliance, and I primarily work on our school-based dental health program, and I've recently been branching out and working on our mental health first aid program as well.
Paul McGinnis, Greater Oregon Behavioral Health and the EOCCO.
John Adams, Director with the Eastern Oregon Healthy Living Alliance, and hopefully we'll get a chance to give you guys an update on what we're up to, and I'd like to come out here as often as I can just to stay connected with what you guys are up to and all the other CACs within the EOCCO region.
Well, John, you don't have too far to cover. For those who don't know, he lives like across the street from us.
Good commute.
I do what I can, Charlie.
You have to put on shoes.
You have to put on shoes to come over here, is that it?
I do. Yeah.
Because Lake County apparently didn't get the memo that spring is here.
Now, this is absolutely our spring. We're the only county that doesn't have what they call the 5 seasons. You know, it starts off as summer, fall, winter, spring, and mud.
Great. Rochelle Hanson, I'm the food corps service member, and I basically work in the schools, elementary schools, teaching weekly lessons, doing taste tests in the cafeteria, and working to support garden projects with the ultimate goal to connect kids to healthy food in school and get them excited about it and have them making healthy choices in terms of their diet.
Diane Clay. I'm with the Lake County Food Chair and Hospital Auxiliary, and generally an interested party in what's going on. And any way I can help, I try to help.
Thank you, Diane.
My name is Larry Coulter, and I'm the administrator in training for Lakeview Gardens.
Sheree Morgan, Lakeview Gardens, and Cedar Center for
Jessica Calvin, I work in dietary, and Sting invited me to come and talk about the food share, or the summer food program.
I'm Christy Albertson. I'm the director of the district. I'm Ann King. I also work with the Oregon Rural Practice-Based Research Network at OHSU, and we've been working with the EOCCO for the last 3 years on the incentive grant program, which is now the Community Investment, the Community Benefit Reinvestment Initiative. And I was here last about 12 years ago to work with Dr. Graham's clinic to implement the Ages and Stages questionnaire for the first time, and this is my first time back, and I'm really pleased to be here. We're very excited about the work that you all are doing this year, and it looks really good. Pleased to be here.
It's changed a little bit in 12 years.
A little. We just got here, so I'm gonna go look around town. The cowboy is still there.
I'm Brianna Campbell. I am the EOCCO Health Promotion Quality Improvement Specialist at Voda Health. Sorry, it's a mouthful. And I do all of the work on the incentive measures. I do the work with or Brandon on all the grants, and the general interest is incentive measures, but I obviously am here for other reasons too. So, yeah.
Excellent. Well, thank you all of you for coming, and our guests. We have lots that we're doing, so. For the regular members, we have sent out, our vendor sent out minutes of the last meeting. If you haven't had a chance to review them, would you do so we can approve the minutes? At any time, I would entertain a motion to approve.
I've already read them, so I'll motion for it.
Thank you.
To approve.
And I'll second.
It's been moved and second to approve the minutes. All in favor, please signify by saying aye. Any opposed, same sign. Thank you, minutes have been approved. Christie, let's talk about an exciting thing that you and Jess have been working on.
The summer food program. We've been talking about it the last couple of meetings, however many meetings. So update-wise, our official application to be the sponsor to bring back the summer food program, which I'll backpedal for yes. Lakeview for the last 3-ish years, maybe more, has not had a summer food program, basically the extension of the free and reduced lunches during the school year. And so Head Start used to operate it, the YMCA when they were over here, they used to operate it, and then kind of when the Y went away, the program went away. And Head Start asked if we could take it on this year, so we're taking it on this year. And as of today, our application is still moving through the state, however that channel works. I don't know how that process works. We don't anticipate any problems with it. It just has to work through the formal channels through the Oregon Department of Education. And we should be approved. If not, they may be coming to us with more questions, but the budget looked good. Everything is kind of informally been approved. We just need the final stamp of approval. We did receive a supplemental grant, a startup expansion grant, also through the Oregon Department of Education. So the fact that ODE gave us this grant is also a good sign that we're probably going to be approved as a sponsor. We have about $11,000, and that's for kind of the extras that don't get paid for. We've talked about this in the previous meetings, how we know that the purpose of the program is to feed hungry kids who might not have access to consistent meals throughout the summer, but to kind of get rid of the stigma of feeding kids who can't afford meals, we're going to have fun programming that's happening there all 44 days of this program. So this grant will help us do some of the programming. Francie Winters, our prevention coordinator, has come up with 9 weeks worth of programming. Vicki Taylor from Head Start has been rounding up just a crazy number of volunteers, and we're still getting volunteers in. We're going to talk on Monday with Lisa Schulenberger, the Honor Society advisor at Lakeview High School, about possibly getting some of her kids. We've talked to the kids about having them just volunteer through the program. Francie's idea is to have junior park rangers sort of trained to help run some of these programming. If we're going to have all of these volunteers in and out all summer long, we need some consistent faces there. So if we have some responsible high school kids who are trained to run the games and who can be more eyes and ears, we're going to have a whole application process for these kids. We're going to talk to Lisa about on Monday. We're also working with
Lisa
Schulenberger, sorry, the Honor Society advisor, and Ted Wilton, somebody help me out, from COIC, is that his last name? It's something like that, thank you. Talking with his kids too. They're good, responsible kids, a lot of them for the most part, like kids. But there's this perception at COIC that, they're kind of the redheaded stepchildren of the district, and they just don't fit in normal school, but they would be wonderful volunteers for this program. So we're partnering with kind of both ends there to get as many good, responsible kids through there. Food, what else do we need to know? What am I missing, Jess?
How's it gonna, what does it mean? Explain what kind of food you're gonna have, and when does this start?
When were we gonna start? The week after school gets out, which I think was.
Well, 1 week off.
Yeah, Yeah, in June, it's like the third week of
June
June.
27th.
June 26th,
Yeah.
last Monday.
They get a health, we have guidelines that we have to follow, so they're gonna get either a sandwich or a wrap. They have their fruits and vegetables and milk. So,
And then do they get a snack?
we opted not to do the snack,
Mhm.
because it was too, I forgot how that goes. They had to leave with the snack, they couldn't eat it in the park, so we had to make sure once they got the snack, they all left.
It was a two separate thing, like
Yeah.
you do the lunch, everybody goes their way, and then they come back for the snack. And the numbers never really panned out, Vicki said, for that afternoon snack. So if we can start with lunch, and then if people are clamoring for the snack, then
You could add it later.
we can add it later if we need to. So, the other piece, so the main site is gonna be the kiddie park. And we did get approval, I talked with Will Cahill. We're gonna try serving meals out of Union too. I don't know what the need is out there. Nobody seems to know what the need is. I'm hearing there might not be much need, there might be, we don't know. But Rochelle is gonna have opportunities at both the in-town site and at Union to do garden-related activities, which would be wonderful for both her program and for the food program, and it might help attract some more kids, especially to Union. And we're also going to try to serve at the state park down in Pine Creek, which is another one where we don't really know what the need is down there, in large part because they're California school kids. A lot of them live on the Oregon side, but for elementary at least, they're California kids. So we're just gonna see.
Are these hot meals?
No.
Okay.
Yeah.
We are gonna have a barbecue to kick it off.
Yep, the first
That
day,
first day.
we'll have a barbecue with hamburgers and watermelon and the blender body.
And the blender bike.
We also have 2 weeks where we have churches as the sites.
Right.
We're trying to do that.
Right, so First Baptist and Church of God both do Vacation Bible School. And we didn't want the kids' staff to choose between Jesus and lunch. So we are going to take the food, we'll have volunteers from the churches take the meals out, and serve as site coordinators, site leaders during those. I think it's 4 days for the Baptist church and it's 3 for Church of God. So
At their designated sites, is
at the,
that correct?
yeah, at the churches will be where most of that happens, so. Yeah.
And in our last discussions that we had regarding the summer food program, we were hitting this barrier that we did not have a storage or a cooler for the milk.
The milk.
We haven't still found a solution to that.
We did, actually. So Head Start, their building is still up and running directly across from the kiddie park, and the fridge is still there and plugged in. So, and even after they move, we've gotten the green light from Head Start that we can store the milk there. So that was a
That's
huge
very nice.
burden off of us.
And just for clarity, are we going to be getting food in installments like every week? Or are we gonna get?
So we will pay however Jess does the purchasing, sorry,
Yeah.
I'm speaking for that, and then we'll get the reimbursement afterwards. So you will handle
Yep.
ordering out, ordering works.
Yeah, so our big order comes in on Tuesdays, but we do have 2 other vendors that deliver on Wednesday and then one that delivers on Tuesdays and Fridays. So if we run out of something, we can always get it. But our milk comes twice a week, and that's from Alturas.
Okay.
And have you decided on the second cook?
No, not yet. We got it under control.
Are we offering flavored milk?
No, just 2% milk. Sorry.
Why would that make a difference?
Well, I mean, chocolate milk and strawberry milk, I mean, there's just added sugars.
We're trying not to offer.
I know, that's why it's good. Of a standard.
Jessica, have you started menu planning yet, or is it a little bit early?
Yes, I have the
Okay.
menus, there, sorry, I didn't bring them. They're in the office, but yeah, I have it all done if you want to see them.
Yeah, I would say, yeah, I'm really interested.
Yeah. Do you have an email I can shoot them to you?
Yeah.
I can give you the.
Okay, that's good.
Yeah.
All right, and I can just.
What
email
kind
you.
of meals? Could you just?
Like one day they're having like a ham sandwich and it has cheese on it, and then, because they have to have so many proteins, so many grains, and then then they'll have a fruit and a vegetable and their milk to fit into the guidelines. So, and then like a wrap, if they have a wrap, they'll have lettuce and tomato with a wrap, and then another vegetable and another fruit.
Because we get reimbursed slightly more than $3
Yeah.
per meal. Yeah.
The reimbursement was, I think, $3.49 a meal.
Something like that.
And depends on what they have, we are looking about, with the paper bags, the napkins, the condiments and everything, we are looking about $3.25 to $3.40, depending on what meal they have. Because some of the vegetables are higher than others and some of the fruits are higher than others. So we're still gonna fall into that guideline.
There will be trainings coming up just for volunteers, that our vendor will learn more about and be coordinating. It's totally excited about. And this, so the sites where we're serving, we were kind of limited. We went off of a USDA map that showed the eligible sites, and I think it was just the southwest corner of Lake County, and I wanna say the northern reach of that was, what's the greenhouse road?
Sunny Slope?
I think it was there. It didn't go north very far at all.
So it does not include Paisley?
So it didn't include, it didn't go as far as Valley Falls, like,
Yeah.
that's why where we're serving, but we can serve everyone 0 to 18, get reimbursed for those meals, so all kids, regardless of whether they live here, if they show up at the park and they're in the age range, we can feed them, so.
And when will we start advertising this?
Soon, Jimmy wandered away, but.
He's gonna be back, yeah. I've spoken to him about it and
Yeah.
probably start advertising before then.
Yeah, and as soon as we have the green light from the state, is probably when we should start hitting it hard. Both looking for volunteers, if anybody else really desperately wants to volunteer.
Yeah, and Wikidealer helped us a lot with the volunteers, but we
Yeah.
still need for some weeks, so, and Wikidealer couldn't join us today, so if you guys could just spread the word. And also for the volunteers, I'll have to set up trainings for them, and I'm hoping to do that by early May.
So we're anticipating anywhere, I met the gal from the Y who used to run the program at a conference earlier this week. And she said 100 kids, which that was, wow, 100 kids a day is a lot higher than Vicky's estimate, which was between 40 and 60. which
You
is
also
kind of
have
what
to
we're thinking.
remember with the Y, they were feeding their daycare kids in there too.
That's true.
So however many kids were at the Y that day was included in
Okay.
there.
Do we
She said 100
anticipate
kids and,
daycare kids to come?
Probably not, because there is no daycare anymore.
Faith Center. Yeah, Baptist Church, no, they don't do it, just the Faith Center does. And there are a couple of little ones, but
Yeah.
nothing big like the Y was.
Yeah.
Well,
You know?
it sounds great,
Yeah.
and we're excited to participate in these, so that's a good one. Thank you for that.
In addition to like advertising in the paper, are you gonna talk to Will at all about having teachers promote it with the kids? Because there's probably a certain chunk of kids that their parents don't know about it, don't read the paper, and the kids would benefit from hearing it from their teachers.
Yeah, we've budgeted, so that's the second grant. We've been approved for one grant. We applied for one through a private foundation that we're still waiting to hear back about. And a little more of that is built into it. Having flyers, having Head Start's a really good example. Teachers at both the public school and at Head Start, making sure that they are in contact with the students and with their parents and grandparents. And having the dual language materials available too, because the kids are gonna be more or less fluent in English, but it's not true of their parents, all their parents and grandparents. So we'll make sure we put the dual language in the applications in ways. And probably more than once, because if flyers go home with kids in backpacks, the flyers never make it out of the backpacks that times. Yeah, any more, and if anybody, if you have connections or they has, has ideas about how we can help spread the word, we want to do everything we can.
Yeah,
to
maybe
make sure
send-
it's spread.
Did we budget for radio announcements at all? So that's cool.
Because a lot of people listen to radio too.
Yeah. Facebook.
Yeah, it'll be on the Lakeview
Lakeview
announcements
announcements.
page.
Yeah.
On the what?
Lakeview announcements on Facebook, that's where all the dirt is.
Yeah, it's very awesome.
Not everybody knows about these things.
In future years, you guys, I think, have it all sort of, this is set for now, but we have a gal worked with them, still works with them Pine Schools, and she was just kind of allowed to go crazy, which is a wonderful thing to be allowed to do. And she's developed relationships with, like there's a farmer out in Kimberly that grows peaches just for them. school, right? And so they've got all these like local vendors that work just for the school because they're like, all right, because you're cool, we'll do this. And so they have, I mean, they've started getting local fish, actually. And they have a guy who was like, all right, I'm gonna get a truck and it da-da-da-da. So they've done a lot of vertical integration with their farmers.
Nice.
And they're getting tons of local produce, meat, milk, all this great stuff. So I think you maybe kind of got it down for now, but as you build this program,
Yep.
she would love to connect, because really taking care of kids and fresh baked bread, like that is her passion.
Nice.
So, oh, yeah.
This is in Lapine or in Kimberly?
Ben Lapine schools, but they're from farmers all out. So one of the peach farmers is in Kimberly, and they farm peaches it's an exclusive contract with Ben Lapine schools. But they're used to doing these, and they know how all the USDA requirements go, right, for what you can give the kids, so they have that muscle memory, and I bet we could translate it to other communities for the future, so parking lot this.
Yeah, actually, along that same vein, maybe we could, I've been contacting some farms down in Surprise Valley, they have like a local food hub there, and they have like a website, and you can order food, and I have been trying to gauge like the feasibility of being able to source some items throughout the summer, even just for like a tasting table to like highlight local produce, maybe not even for like a full meal. But yeah, there's definitely a possibility there, and I would love the contact information of that person.
She would love to get you into negotiations.
Yeah, I love that as well, yeah. And also I was on the phone yesterday actually with some folks from the USDA, and they're like community food systems department, and we were talking about like best practices for this like farm to summer kind of concept. So a lot of farm to summer, yeah. So it's kind of like buzzword sounding, but like farm to school is kind of a lot of what I do with Food Corps, right? Like trying to connect kids to like the food system, and through the food, but also in terms of just education, right? So then trying to continue that through the summer, farm to summer, would be kind of the way that I'm hoping my role will go. And I know we're kind of in the planning stages still for the summer food program, but I'm hoping, to be able to kind of continue some of the concepts that I've been teaching in the schools during the summer, and also use like school gardens, possibly, hopefully, and at least the produce from the gardens as a way to, and maintain them throughout the summer months, and also, just continue those connections and, I don't know, keep the students engaged with those garden projects throughout the summer.
Excellent. Christy, anything else on Food Corps? Otherwise, that sounds fantastic.
That's you guys know what I know.
Is there an education component to the programming that you're talking about?
Yes. We will see how the second grant, we asked for a lot of supplies, kind of split it between these two grants. We got some fun educational materials that we're gonna be able to live well beyond the life of just the summer food program. And some more fun. Yeah, it's kind of a combination of art and craft and sports and science.
What Rachel's doing sounds like a really good fit with the program.
Yeah.
Excellent. Great, thank you. Our vendor, let's talk about chip.
Yeah, before we,
Oh, Outback Strong Health Fair, or was that it?
Oh, no, that's the
Somebody
second
skipped that.
one. Sorry, let me try to sneak two things in on that line.
Let's go back to Christie, because she was talking about Outback Strong Health Fair.
So this was, you guys know, one of the three things that you guys think you approved. For the dollars, and I'm not gonna repeat the long name of the dollars, the transformation dollars. And the health fair, we got our first check, I'll say that just arrived today. We're really excited, which means we can order the blender bike, which is the most important thing. I realize the most important thing is actually helping teenagers, whatever. We get a blender bike.
Wait, did we get it? We're gonna have
We're
one?
gonna have the blender bike, yes, that was built into the budget.
Wow. I thought it was kind of like a rental thing, like a
There's
rental.
a lot that in California, somewhere in the Bay Area, who builds them.
yeah, we don't know if the health fair will take place, but we are getting.
We're getting a blender bike.
You're
You
good.
know what a
Your
blender
office.
bike is?
You need
Excellent.
your own helium station, that's what I understand about it.
You need your own healing station?
Helium. Helium.
We're gonna have to get some balloons and,
I
yeah,
know.
there was a
You
whole.
know, to drive to Klamath to get them, that's what.
Well, there's nobody to get in here in town.
That's not even Safeway?
The 39ers, but they don't have a very big tank.
Yeah. Not for all the bullets, Randy.
Mhm.
We need to go to party time or somewhere in Klamath.
So I wanted to add something to the health fair.
Yeah, sorry, to the nothing that I said.
So after having the meeting, I had a meeting with and Leona, Christian, and so how we have planned the health fair is that we are gonna, speaking with Bobby, we decided that we'll be doing the sports physicals before the date of the health fair. But then they told me that that's not probably a good idea because the track record for the counties that have conducted these health fairs, if the sport physicals happen before, there's not a good turnout. So I'll have to schedule a meeting. I have a meeting with them next week. I don't know exactly which day it is. So I'm gonna try and convince Bobby to move the sport physicals to the health fair. But yeah, so any suggestions of how I should go about that? Because Bobby's pretty set in her ways. That's what I keep hearing from everyone.
Well, it's just from physicals.
I know it's Bobby's thing, but has Rusty's ISET been involved at all, the athletic director?
We had planned to involve him, but yeah, we haven't involved him yet. But
It's been the building principals.
yeah, superintendent and the principals involved.
Yeah, Rusty's a friend of mine, next time I see him, I'll encourage him to get involved in it. I know Bobby's pretty stubborn, but getting Rusty involved.
She just
in there
has
is like-
those physicals down to a science, and
Yeah.
she's done them for decades, so. You went through them, I went through them, our parents probably went through them.
Because we need to do a lot of coordinating for the health fair, and if the sports physicals happen before the health fair, probably it'll be a failure which we can't afford. And also they suggested to get the providers to be present at the health fair. So today we had a meeting with Warner Mountain Clinic, tomorrow we'll have the Lake Health Clinic. So Dela was kind of on board today that we should try and get the providers in the same venue as the other stations of the health fair. And that will also help us out because we also had a big problem with transporting all those kids from the school gym to the clinics. Yeah, so those are the new developments and I'll keep you guys posted.
Does Bobby know what the health fair entails? Does she know what it's about?
Yes.
Because I would think if you express to her how there's more to these bodies, these teenage bodies than just physicals for sports, there's gonna be so many more things that they can access at that health fair. I would think she would want to do it.
She's really excited, talk about having a nutrition section, that'd be one of the, which doesn't necessarily meet, you know, the criteria of the adolescent welfare visit, but talking about nutrition, and she thought that would, she's still coming at it for her student athlete point of view,
Yeah.
but, yeah, I think she understands to some extent at least the broader, the vision of it. I don't want to speak for Bobby, but, yeah.
Good.
She just has had this thing down to a science for so many years, it's a.
20 there,
Yeah, I know.
Can it be both?
I do mind if I just mentioning. Our suggestion was to still include her and have her do the physical health piece of it, just as far as height, weight, all the things she did before. But have it as a station on the passport idea and just include her and incorporate her, but have them not get their, final write-off on their sports physical until the very end when they reach the provider. And the reason, historically, a lot of our counties have just 100% gotten rid of the sports physical because you can't get reimbursed for it. And so part of the problem is, the providers aren't getting that reimbursement at the end of the day for performing, their services and doing that total health idea. But something we mentioned to Arvinder earlier is that some counties have taken it upon themselves to
take the money they get from these adolescent welfare visits and put them back into the sports programs at the schools.
Oh, that's cool.
So if that was something you wanted to work out with your clinics, then you could, but that's just one thing that they do. Or if we talked to Arvinder a little bit about this too, but you know, even if it's just for future, considering taking a chunk of money and donating it in the budget to that piece just to get that buy-in. So that's just something, a couple things we've talked about.
I think for a lot of practitioners, they have been donating their time.
Yeah.
Right,
And that they're very committed
Absolutely,
to
yeah.
providing that service. And the issue of charging is the last of the things on the mind.
Yeah, I think because they've been doing it for so long,
Mm-hmm.
you know, it's just a nice service that they,
Yes.
it's what they give to our community.
Are there any talks or any possibility of talks between the CCOs and, OSAA to change the requirements so it's not just a sports physical, so that OSAA requires something?
Actually, there has
All
been
sport
effort.
is there, yeah.
Yeah, it didn't
I
go.
was like, I don't know about that.
It went real well, did you
It
say?
did
Paul?
not go very well. The Scholastic Sports Athletic Association was, I mean, they're focused on what,
On student athletes.
on student
Yeah.
athletes.
Okay, well,
Well, we're trying to start
OHA through the
start hearing,
CCOs
yeah.
reached out to try to make that consistent. It's just not what their business is.
Yeah.
Okay.
So for the chip updates, the first is the dental screenings. So the good people from Advantage Dental came to Lakeville yesterday and we started our dental screenings at ADA Gym at 4 p.m. And they were there for 4 hours. And they're also there today. They have been there today since 8 a.m. and they're gonna be there till 6. We're hoping to do it till 8 p.m. again, but depends on how much turnout we receive. Yesterday we saw 10 students, children. We are hoping to have a better turnout today. And also Advantage Dental provided me with all the tooth kits which we have to give to Dally Middle School students and also our ADA Fremont School children. And yeah, so I'll keep you guys posted how what the numbers are for today. And hopefully the dental screenings which are due this winter will be during the normal regular school hours. Coming to telehealth telemedicine, I and the wellness department, Trace Monza and Heidi, we had a productive conference call with Peace Health. And the wellness center wants to utilize the telemedicine telehealth opportunity for setting up a behavioral health department for children. And they want to set it up in one of the rooms at Marius building. And so we are just working out the details. We spoke with Peace Health people and they have crisis workers and behavioral health workers available 24/7. So that's working out good. I also spoke with Polycom and telemedicine.com. That's the name of an organization who's going to provide us with the equipment for the telemedicine project. And so now the timeline, so now there's more structure to this project. The timeline we have formed is that before the end of this month, we'll be ordering the equipment. And sometime in May, we can set up a provider, a digital provider and wellness center link, so we can probably see people through telemedicine.
Can you remind people what the nature of the grant and the amount is?
Yeah, so we were awarded close to $100,000 through this grant, and the hospital is gonna match $50,000 on top of that, so we have a good amount of money. We have $150,000. And telemedicine, telehealth is a concept which is gaining popularity in recent years. The idea is that in rural areas or places where there's a lack of providers, the patients can still see them via the internet, and we'd still be ordering equipment in installments because we still don't know how we can spend all the money. But for now, when I spoke last with the wellness center, I think it was close to $20,000 to $30,000 that we thought we could spend. But we have more time to decide that, and they know it's a new idea and it's kind of experimental. So yeah, so that's that. I'm hoping to order the equipment before the end of this month.
Can I add one piece to
Yeah.
what you just said? So part of the reason, what we're doing now and what our vendor and behavioral health are trying to figure out, when we applied for and when we were awarded this grant, it was before Lake Health District had taken on the wellness center. So they were not a factor at all in me, and it makes so much sense. We wrote in the behavioral health piece that was intended to be part of this grant all along. But having the actual entity, the wellness center as part of the health district has kind of thrown a wrench into things, not in a bad way, but just in that we have this new aspect to consider, which is kind of, our vendors have to start pretty much from square one to figure out how we can best spend the money, which is, yeah, interesting. Challenging. Fun.
Coming to the gatekeepers program, so I've been working closely with Eric Sorensen, and so as I mentioned in the last meeting that we were having an issue because the way we designed the grant, the idea was to send surveys by mail to all the seniors in Lake County, but then we realized that we probably will not be hearing back from them that much, and then our plan changed to contact organizations or agencies who come in contact with many seniors, and they could hand them out and get them back. Places where we give out free meals or churches. So I've been working with Eric Sorensen, and he forwarded, so basically we have handed out the surveys to all the ministers in Lake County. Then I'm also working with Kim Ishida, and I'm forgetting the other name. They take regular trips to Christmas Valley. So we have 2 churches over there which we are trying to get the surveys back from. And then according to the data, we have close to 2,000 seniors in Lake County. But I don't think it's realistic that we'll be able to send surveys and get a reply from all of them. So we were aiming for something between 1,200 to 1,500. As of now, I have been successful in sending out 100 surveys, and I'm working on it. Still have a lot more surveys to send out. And I've also been in touch with the Council on Aging, who are again going to provide us with the gatekeeper training. And they said the earliest they can send somebody to train potential gatekeepers will not be before late May. So, which is kind of good because this program is getting a bit delayed from my side. Yeah, I guess that's anything else. Yeah, that's the gatekeepers program. And Rochelle, could you give us some updates about the food court?
Sure, some quick food court updates. Continuing to teach the weekly lessons in my classes. We've got some plants growing. I planted seeds with kindergartners last week, which was pretty crazy, but hopefully we'll get some plants growing in that classroom. Got some hydroponic stuff set up in our 5th grade, Miss Kylie's classroom. Yeah, so lessons continue, going well. Taste test, our last one at 80 Hay was jicama fries, just jicama sliced up in the shape of a fry, not fried by any means. But yeah, it went over well. About 61% of kids said they loved it. Starting to wonder though how much there's like a little bit of like peer pressure bias to just like stick your sticker where all the other stickers are, but who knows, whatever, there's still 61%.
How many have tried jicama in the past?
I definitely had a few kids say, oh, I've had this before. Most of them didn't know what it was. Yeah, so that was kind of the idea. That was kind of the hope.
I feel like many adults don't know.
Yes,
Yes.
well,
I don't
and,
know to explain it to you.
yeah, and to be fair, we had to specially order, the jicama through Safeway, because Safeway doesn't typically carry jicama, and it's limited produce section, so.
Just out of
Yeah.
curiosity, how many people here have tried jicama?
Oh, yeah.
How many people have not tried jicama?
Healthy people.
Man.
Alright, I believe there's still some at Safeway, so go grab it.
Oh, is there?
I think it should be,
Great
yeah.
to try,
like,
just so that you
Doesn't
know.
look like
Jimmy, you didn't have to
it.
raise your hand, I saw that.
I'm looking it up on you.
It's actually, if you know anyone who has diabetes, it's actually
Looks like a
apparently a
potato.
really good,
Like a
Good vegetable for
a
it.
really good source of sugar. There's something about the sugar in the jicama, like it has a sweet taste, but it doesn't
But
mess
it
with
has,
your-
it has enough like fiber in it so that it's balanced, you know, it's like fat, fiber, acid, lowers the glycemic index.
Yeah, and it's some sort of like, no,
So it's pretty
anyhow.
crunchy, but it has a very low glycemic index.
Yes,
So you
I can-
can enjoy it at a very low glycemic load if you're diabetic and you have the sweet taste.
Yeah, sweet.
Excellent.
So more juice.
Yeah. Let's see, what else? In terms of garden projects, Union's greenhouse is really getting close. I think it's like waiting for like a door to be put on, so other than that, it is almost complete. And then there's gonna be a work party probably mid-May or so with parent volunteers and teachers to build, I believe it's gonna be 12 raised beds that'll be within the greenhouse. So it's pretty exciting. Going a little bit better than our Fremont School Garden project, but that is okay. Last I spoke with Susan Warner, the principal at Fremont. The like final verdict after like a fair amount of like pushing and prodding from my end is that it's just gonna wait till June before maintenance has time to like prep the ground, prep the grass, or like, you know, kill the grass, and then also deal with irrigation and sprinkler systems and whatnot. So it is what it is. We do have some containers coming from True Value, so I think my hope is to kind of set up a little bit of a garden space, hopefully to plant our seedlings that we bought going. So that is that.
Rochelle, could you talk about what the thoughts are for next year?
For next year, yeah. Well, there will be a new food corps person serving next year, so they will come in August. So that'll be that kind of transition moment over the summer. And then, yeah, in theory, they'll be doing sort of, you know, carrying on what I've been doing and hopefully
That's okay.
maybe, you know, starting their own things. I think a really cool thing would be implementing menu changes in the cafeteria, which I just haven't really, you know, doing the taste test, but the menu itself hasn't been changed. So the idea would be to, you know, link the taste test to say, oh, look, 66% of kids love jicama, let's serve jicama once a month, you know, from now on or whatever.
To me, and then I can have it by Monday.
Let's see, what else? And then, yeah, so garden, I mean, hopefully there will be a garden established at Fremont School this summer. And so then throughout the fall, you know, Lakeview's like 90-day growing season, you know, whatever,
Okay,
throughout
thank you.
September, the next service member
That's
can
okay.
continue
Okay.
to grow, you know, grow plants, grow vegetables with the students, teach lessons out there in the garden space. I think it'll be really nice for them to have a garden space that, you know, food corps lessons are supposed to be hands-on, and it's a lot easier to do hands-on stuff when you're outside working in the garden than it is indoors. Not impossible indoors, of course, but so it'll be a nice resource for the next person to have at both Union and Fremont. Yeah, I don't know, do you have any other just like more specific thoughts about, okay,
So
yeah.
I think it's always good for people to hear and understand a little bit of.
Sort of like
our
the,
thoughts
yeah,
for next.
the vision, yeah.
So you don't know who's coming?
No, so
And
actually,
does-
I don't know if Sing knows more, but I think it's like coming up that we're gonna start getting, I think we get around 10 applicants. So, you know, people applied by March 1st to, you know, on the national level of food corps, right? And then Food Corps National kind of divvies them out to which states people want, and then ODA for Oregon will go through, I think they go through like 100 or so applicants, and then send out about 10, I believe, to each site. And so there's like 10 sites, and then
So,
so me and Sing will be going through those applications, and then interviewing people, possibly with also another person from ODA who will help us with the
how, across the nation, how does Food Corps make sure that programs stay consistent? I mean, let's say you were the second year person, and you came in here and you saw what the first year person did, and you wanna do something that you're excited about. How do you maintain that consistency?
Yeah, no, it's a totally fair question. I of course had the option, you know, I could have opted in for a second year. It could have been that longevity. I mean, Food Corps could require 2 years. I honestly think that for a new site such as Lakeview, like it would make a lot more sense to have it require that the person who comes is gonna serve for 2 years. Cause like, yeah, so I've had some like personal debate over that, we don't need to get into that, but I've decided not to, you know, do a second year. So yeah, there's gonna be a new person, they're gonna need to transition. I'm definitely gonna be here to like support that, and I really want to orient them, and you know, I mean, cause this is kind of been kind of a, big thing for me that I've kind of been spearheading, right, the whole food court thing in Lakeview. And so I do really want it to be successful next year, and so I'm, more than willing to be in contact with them throughout the next year, but definitely to try and smooth that transition in August. I'm definitely gonna plan to have some overlap in our time here.
You leave in July though, right?
I serve through, my last day of service is the 31st of July.
Okay.
And theoretically, they've changed it, so their first day will be August 4th. But then they're going to like orientation and like, I don't know. So we will overlap. But yeah, I mean, I think the tenets of food court are pretty solid in that it's like hands-on lessons, cafeteria, and like, school-wide culture of health. So I think there will be consistency in the projects. They might deviate a bit, but hopefully it's just kind of building upon what's been started this year and just, trying to move forward in similar ways.
Yeah, and I would like to add to that, my experience with food court, I think they're very good at tracking. For example, like every week I have to sign her timesheet, and then every new service member has to form an action plan, and there are a couple other things which by the end of their stint, if they are not done, then it's not late. And even for the service, the site supervisors, we have like all the site supervisors in Oregon, we have every 2 months we have this conference call with the food co people where we have to tell them about how was the progress with all the projects that we have. So I think if a new service member comes and they're not doing a job as good as Rochelle has been doing, we'll find it out pretty soon, and I'll have to answer to the food co people. Because so.
Okay.
Yeah, there's very much communication.
There's some core places where they have to stay, but they can still be creative on their own.
Yes,
Okay.
yeah.
What can we do? We've got a good program system in place, it sounds like, from kind of the top down, but the people in this room, how can we support you, support the new person, make the transition go smoothly, and make sure that food core is sustainable here?
Yeah, that's a great question. I think like having these meetings, having like actually just, a dialogue and communication is always helpful. It's interesting because this is like a community health, CHIP meeting, right? Where kind of like, whereas like food court, I feel like I do less community outreach as much as I do like very, pretty specific, like I am in schools more or less. But in terms of like the summer food program, that's something I'm really excited about, like, kind of like getting food court kind of into the wider community in a way. So, I don't know. I know last meeting I was asking for like maybe donated labor for the gardening projects, and that's definitely something that still eventually could be really helpful.
I was actually going to ask, is the school not open to having volunteer labor come in? Do they only want their maintenance to do it?
Right, so I appreciate you connecting me with your boyfriend there at the prison. I think it's that with irrigation and sprinklers, they, like, the maintenance guys, like, know about that and have that information, and so they should be the ones, dealing with it. But I don't know, I got mixed it's mixed messages, because Susan said, like, oh, we probably don't need, it's not gonna be a huge space, so like we probably don't need to go to the trouble of getting like donated labor from, like, parole from the prison, right? But then again, maintenance doesn't have the time to do it until June, I don't know, so I feel like I've just like been pushing it as much as I feel comfortable, and so I don't wanna like step on toes, and if it happens in June, it happens in June, and it's possible that we might need some donated labor in June. Spreading gravel, I feel like would be a pretty tough task, so having help for that could be good. Installing a fence, I have no idea how to do that, so.
Thank you very much.
Yeah, that's
Sounds
about it.
great. Christy, should we move on to you and talking about grants?
So while I'm thinking about it and talking food core, Rochelle, Becky, we have a grant, a small grant from the Oregon Department of Agriculture to kind of supplement the work that she's doing through food core, and she got the approval to use some of those dollars to buy fencing for the raised beds at Fremont. which is huge because with the urban deer population is out of control. It's like the garden did not stand a chance. So we're gonna get some fencing and we're glad that we could help get that paid for through that. That's really good. Otherwise, everything's kind of, we're waiting to hear on grants. We're still waiting. Francie's not here to talk about it, but we submitted that application for the Outback Wild, I think is what we ended up calling that. The seeds and the beautification and the gardens and pairing kids and seniors to plant the bee, butterfly friendly native. We're still waiting to hear about that proposal. We're waiting to hear, like I said, about that second summer food program grant proposal. A couple more RFPs just crossed my desk today that are related to behavioral health that I haven't even had a chance to talk to you or Trace or anyone about. So there are things coming down the pipe, but we're kind of in a weird holding pattern right now with nothing super exciting to report. But
Perfect. Anything else on CHIP that we need to think about? No. Okay. Since we have some important guests, I think we'll start with ladies first, John, so you don't have to wait. Andy, want to have any comments or?
Yeah, I mean, I guess we're really interested in hearing whether you all have any questions or things that that we could help you with and moving forward with your projects. I think, you know, they've been laid out beautifully in your grant proposals and really clearly, and I think you've got good methods. And we've had a chance today, and we'll have another chance tomorrow to spend some time talking about metrics, which is usually what we do in our first visit, so I don't know that we need to talk about it right now, but you know, what can we help with in terms of understanding how the incentive measures work, what other groups are doing, that sort of thing.
No questions? I guess it's really clear then.
Well, you said first visit, is there more planned outings?
Not at this time.
Okay.
So I meant first meeting.
Okay.
Usually we do this by the phone and we spend a lot of time talking about your project plan, your metrics. But for this county, it was all really clear, which is amazing. So we've been able to dig in deeper and talk to the clinics about clinic flow and how they're gonna capture data and, you know, handle things like the volume of students coming through to get their child visits and, or adolescent welfare visits and things like that. So, yeah, and I know you all talked with Baker, so you kind of did your benchmarking, which was terrific, and learned about what they've done with their program. I think today we talked about what some other counties have done around the sports physicals. So,
Do you have any suggestions, either of you, of what things we ought to, as this committee, roles that we could do to help us all get better results?
yeah. Well, so let's spend a minute just talking about the colorectal cancer screening project that's gonna happen here. Number of counties, and Paul has been very involved in this, so speak up, feel free to speak up, but a number of counties have worked on trying to improve their colorectal cancer screening numbers, and I think that there's a huge educational component to screening, explaining the value of screening every year if you're doing the FIT test, why that is just as good as colonoscopy, what it means to do the FIT test, what you have to do with the test, why it's important when you're 50 and over. And so I think in other counties, one thing that LCACs have been really involved in is just getting the word out. And I know you all are planning some of that, but have you spent time talking about kind of how the LCAC can play a role in being leaders and explaining why this is an important thing to do? So my suggestion would be to think about
before,
You guys mentioned it in the grant submission a little bit, just about incorporating it into the greater Outback Strong vision. But as far as creating materials and disseminating that information.
So we have plans of spreading the Outback Strong concept, and most of our programs in future we want to add the Outback Strong label to it. But we are again waiting for us to receive the NCAC dollars,
Right.
and which we have received a portion of it today. And yeah, so we are just planning on doing some aggressive advertisement. And a couple of our programs we are planning to just name them Outback Strong, whatever. And yeah.
But they also, who was the fellow, Charlie, that was the minister that did the food program stuff from Klamath, the big truck? I remember it was in our minutes, because then Jimmy wrote about it, and somebody read it and said, there's gonna be somebody who's gonna preach from the pulpit about
How great it is.
colorectal cancer and the
Well, Mike
importance of it.
Newcomb
And
did
then that got forwarded to the head of the Oregon Health Authority, the minutes from there, and it was like, okay, this is why we have communities involved. You know, so I do remember, that was a couple of years ago.
Yes.
That was Kirk that was gonna
That's right.
do the food from the pulpit. And then I think it was Mike Newcomb now, who has the big,
From the pole.
that's what he said, we talked about poop on the pulpit. Something poop in pulpit.
I don't think Jimmy wrote about that.
You didn't write about that, Jimmy?
Not the poop on the pulpit.
I think I left that out.
But yeah,
It was Mike
I'm
Newcomb
mixing
with the truck,
people up. Okay.
So we spoke a little bit earlier about social marketing through Facebook.
Oh,
and
you know
it
what,
sounds
that
like the
maybe-
community has a
was that
Facebook
done?
page, and that might be something that, do you call it a page, a Facebook, whatever?
No,
Lakeview announcements.
okay?
Lakeview announcements.
Who runs it?
Is
Is he, what does he
He's a
do?
state trooper.
Okay.
Yeah,
He's a what?
you'll have a little something to snack before
Does
then
he
if you
do,
want.
like health
You can
promotion
meet down there.
things
or-
on it, or is it just kind of
His
more like
deal
a?
with it is
Call you
people
when you're
post
ready.
whatever they want on it, and he just
Okay.
monitors it. When things start to get offensive or argumentative, he'll delete it. But it's just a
community
anyone
comment.
can post anything.
Jimmy, you have,
Yeah,
the examiner has a fair amount of information about that too, right? You have different ways of promoting things, whether it's the 2-minute message or the, whether it's the main newspaper or, so there's a lot of different ways that the paper is promoted. We have lots of ways of.
Yeah, so more social marketing. In some counties, physicians or prominent members of the community have written op-eds for the newspaper explaining why they choose to do the fit test, or, you know, why it's important to them and that sort of thing. So you all could think about some of that. Paul, do you have suggestions?
Well, it's things that John will talk about when the OHLA follows up on what we heard from the 5 focus groups.
Oh, good.
That's
Oh,
right.
Good, yeah.
Thank you. Thank you, appreciate that. Kristen, are you ready to talk about what?
That's,
Kristen, why don't you talk about Healthy Heart?
Yeah, I was gonna say, I'm not sure what else, but I guess,
You can't come here and not talk.
I think I've contributed a little bit already.
It's an opportunity.
It's an opportunity. So, yeah, we'll talk a little bit about Healthy Hearts Northwest, which both clinics are involved with. And so it's pretty cool because this is a national project. There are 7 cooperatives across 11 states. New York City is one cooperative, by the way. We are part of the Northwest, so that is Oregon, Washington, and Idaho. And so we work with other facilitators who are up in Washington, and we're all kind of part of this team where we can kind of talk about what's going on with the different electronic medical records, because as we all know, data reporting can be painful, right? It can be a real challenge, it can be a real barrier. So we've provided some technical assistance to help get data around the 4 heart health measures, and that's aspirin per whom it's indicated, blood pressure control, cholesterol management, and smoking cessation or tobacco cessation, so the ABCs. Pretty simple stuff, right? But it's been a challenge. Clinics have struggled, and we've actually, but because it's a national project, recently Athena Health, which is the electronic medical record that Warner Mountain uses, Athena said, you know what? we think this is important, and they rewrote the code so that you can now pull a year of data. And they used to not be able to do that. So it's really gotten some good national attention. We're creating science where people get their care, which is in primary care. So we're helping them improve care, and in the meantime, we're trying to see what the best practices are, what makes the biggest difference in the clinics. So it's been a pretty fun process, but oh my gosh, the winter in Lakeview, it has been a pain in the butt to get back and forth this year. So we try to do about a touch every month, either in person or we do like a Skype. But sometimes getting out here has been a bigger challenge than not. I'm coming from Bend. But yeah.
Ben's had the trouble.
That's right. My gosh, 6 feet in town this year. It's just like 2 weeks ago that my pile finally melted.
They just don't have proper
The infrastructure?
snow removal.
We have one plow.
Well, like I said.
We have one plow.
Problem.
We have one plow. Yeah. So the clinics have been doing good work. Of course, the docs have challenged us at times and been like, I don't believe you. Prove it. And it's great because we've been able to. So they've really come over the time we've been working together and opened up to the data a bit more, opened up to the science a bit more, and are from what we hear, addressing some of these issues, the heart health issues with their patients differently with a different toolbox.
Well, thank you. Thank you. Alana, would you like to?
Sure, yeah, I have our little handout here. I'll give just a quick update. Not a lot has changed since the last EOLA update. With our Healthy Happy Smiles program, I guess the biggest change is we have our final report done. I do have some hard copies here in case anyone wants to take a look at that, but it is available on our website. We received our year 2 grant from the Oregon Children's Dental Health Initiative, so we're excited about that. We're working with Advantage Dental on plans for next year and moving forward. The biggest change for next year, which is not even really a change, is we're planning to expand into a few more schools. We have some areas where we are involved with the middle school, and we also want to get involved with the elementary school. Come full circle, so more people within these small communities are getting involved. So you guys can take a look at that on our website. Mental health first aid.
Before you go to the mental health
Yes.
first aid, I looked at the report, and what would you say is the most important thing to see in
The consent form,
that? Well,
return rates.
yes. I mean, that's the difference, right? In the
Yeah.
what worked and what didn't.
Yeah.
When you look at the data, and it's,
Well, we spell it out in the report.
Yeah.
Everything in this program flows, the success of the program really flows from your ability to be able to collect those consent forms, because everything is positive consent. We need consent to do a screening, we need a consent to do fluoride application, need consent to do the sealants, and so everything flows from your ability to do the screenings. And you can see in the numbers that
it's dramatic.
we've been overall, we've had really strong numbers in 2 counties, and in 2 counties we had low participation because of a number of factors that really contributed to why we didn't get strong parent consent returns.
But it's the key, and it's a relationship that your LCAC has with the schools. And I know our superintendent here has come last couple of meetings and wasn't able, but the ones where those folks are here consistently has made a big difference, and it makes a big difference for writing an adolescent well clinic visit. So think about maintaining those relationships with your schools as best you can, because the data it's right there.
Alana, can we make sure that our schools, our superintendents all get digital as well as hard copies?
Yeah.
So the superintendents understand the impact. And we really focus on how important it is, because this is a significant issue for our rural communities. Not everybody understands that, but of course, those of us that are in the business know that people without teeth don't get jobs. And people without jobs don't they do live in poverty. And so when we think about the impact that having tea, having healthy tea, really does have a lasting impact on people's, from children on, it really directly impacts their life. We have a huge opportunity. And we can make a huge difference on a portion of the population, I mean, on a generation in Eastern Oregon. That's how vital this is.
We are also.
Plus, I mean, just to make a point, I'm sorry, but you know what?
Go ahead.
Advantage Dental is putting a lot of resources
There.
over at that gymnasium right now, or yesterday.
Both.
Well, but if they only serve 10 kids,
It's a tragedy.
then, you know, you have an advanced practice hygienist and someone else there for a long time, then they're gonna start to wonder where they need to put their own resources. I'm not speaking for them, but if I was managing a group of people that had to serve all of Eastern Oregon, you know, you understand what I'm saying. So we gotta get the consent, so.
Building the relationships with the schools is extremely important. I mean, we have some schools where, and granted, most of the schools that we're in are small, you know, 200-300 students max, but even the schools that have one teacher that is super passionate about it, their numbers are so much higher than the other schools. So it's important to build all of those relationships, and we are rolling out our incentives program with this. We tried it out in 2 schools this spring. We did a second service date. Unfortunately, with the one school, Baker Middle School, it was not as successful as we hoped it would be, but they gave their students a 4-day window to get the consent forms home. So unfortunately, that was lower than we wanted. But we do have Vail Middle School did incentives. Their consent forms were due today. So Monday, they have a 4-day school week. Monday, I'll call their principal to find out how that went. Hopefully, those incentives get the kids to, and we do
What were the incentives?
So student incentives, we did, depending on the community with our middle schools, we give out 5 $10 gift cards. So returning your consent form, whether it's a yes or a no, doesn't matter. As long as you return a signed consent form, you get entered into a drawing. In Baker Middle School, it was a gift card to a local coffee shop, and then in Vail, we did to a local restaurant because they're a smaller community. And then teachers, the teacher with the homeroom that has the highest percent returned consent form return rate, they win a $50 Amazon gift card. That's extremely attractive to teachers because most of them will probably take that $50 and just put it right back into their classroom. So those are the incentives we did. With elementary school students, we're going to do every student that returns a consent form either gets a pencil or an eraser or a pencil sharpener or something of the sort, so everyone gets something for bringing that back in. And then most schools are actually matching. You know, they're saying, okay, well, if you're going to do this incentive, we're also going to match it. Baker Middle School did in addition to the classroom with the highest percent, the teacher getting a gift card, that class won a special dodgeball game. So they like to match that and really give the kids a reason to bring these back.
Sorry, go ahead.
Oh, no problem. So mental health first aid, we just really want to focus on, you can see what our goals were and what our results were. So we met or exceeded all of our goals, which was super awesome.
Was that in all of Eastern Oregon? How much of that was in Lake County?
Mental health first aid, we didn't do any in Lake County this past year. We were in 4 counties.
We don't care.
So every county but Sherman and Lake, and then a couple counties had multiple trainings.
Mm-hmm.
So in Sherman and Lake, we reached out to the schools and law enforcement, and we're in discussions. And because of scheduling issues, we weren't able to do that. In Lake, we I believe when I talked with Will, initially he was committed, and then I understand that he has another plan where he wants to get his counselors trained and have them train the teaching staff, and then with David Kerr in North Lake, just not able to identify. He kept giving me dates that were like a month of, like, he wanted to do 4 hours on one day and then 4 hours like on another day a month apart. And for the fidelity of the program, of the training, you gotta have like back-to-back days or within a short window.
Are your trainings, there's a law enforcement training, there's a teacher training, and a general community training? Is that, what do you guys?
So we targeted teachers and law enforcement.
Okay.
But there is an adult and a child mental health first aid.
Okay.
And there's also a veterans one, and now there's a rural module, but I think the trainers in Eastern Oregon automatically apply that.
So we are in the process of seeking funding for the next year. We want to be able to continue this training. We want to branch out, so not only law enforcement and teachers, we want to try to reach other public and social service employees, and then as well as church congregations. You know, we really want to reach individuals that are in contact with a lot of people. It's a great training. I got to attend a training in LeGrand with their law enforcement. And the approach to mental health is, it really helps break down the stigma of it, and it teaches you a lot of useful stuff that, you know, you can use in your everyday life. So we really want to be able to continue that. So if anyone has any leads on funding or grants we can apply for, we would absolutely appreciate that.
There's a haiku contest, you know, the OCF haiku contest in August.
No?
It's literally your application is a haiku, and yeah.
Okay.
The first prize is $8,000, and then I think second prize is $5,000, and third place is $2,000. So
I will
just
do
yeah.
that.
What's the rules again on hiking? No.
Brush up on my high school English skills.
Thank you very much. And John, we certainly don't want to leave you without an opportunity to get on about or talk to us about what you're doing.
Well, I'm just gonna continue, I think, what Alana's started here. So just on this handout here, looking at the colon cancer screenings. So this is, I think we shared with all the community advisory councils in the past kind of the summary of the findings. We developed a final report, which was really just more narrative to the findings that we had shared with everyone previously. And so I think the big update was really that we submitted a proposal with the Knight Cancer Institute to do, to basically implement the findings from our focus group report. And essentially, kind of similar to what has been talked about here today, is just really kind of a strong outreach piece where you know, we want to do work with community advisory councils to help get the word out with flyers and you know, posting in traditional posting places. We want to do community meetings, and so go to you know, several community meetings where we can talk about colorectal cancer screenings, and ideally within those meetings, we'd like to be able to identify someone locally who can share their testimony. If not, we'd like to be able to just kind of open up discussion and invite folks to share their stories around colorectal cancer and screenings. And then
Community events.
Also just kind of traditional outreach as far as like media, like earned media, advertising, PSAs, etc. So we also want to partner with a local organization that's already has a planned health event, and so we can table, and we want to be able to provide Nolan the colon, which is a giant inflatable colon used for educational purposes. And we've been able to partner with the American Cancer Society, the Oregon chapter here, and they're willing to loan out their Nolan the colon for use for that. And we've been able to, and then just the last piece, so the idea is like, you know, to do a big outreach push and education, and then to partner with clinics and to do the direct mail and to promote the screenings and to provide access to free kits. And as part of that, we want to do follow-ups, and so work with local volunteers to reach out by phone to folks that to the senior population and support provide support for completing the screening kit and turning the screening kit in, and then working with the clinics to be able to follow up on the screenings and to chart the screenings, and then yeah, so I think that's it. And then for integrated nurse home visiting, so for the colon cancer screenings, so we looked out throughout the region. There was a number of counties, including Lake County, that elected to participate in the transformation grant funding. And so we looked at the other counties that were still out there and that had relatively low screening numbers over the past couple of years, and reached out to those community advisory councils, and based on that, Union, Morrow, Gillum, and Sherman counties elected to participate in the project. And so they were included within the proposal. We'll find out in May if we get funding for that. And then integrated nurse home visiting program is over the past year, we formed a work group around this program, and we've got 4 counties who are interested in participating, including Umatilla, Morrow, Grant, and Malheur counties. Essentially, we want to support early childhood health by addressing maternal depression, and the way that we want to do that is by integrating behavioral health services into home visiting programs. And so when risk factors are identified for depression, then home visiting nurses reach out to mental health providers and they come in to the home. So this is what's unique about this program, is that typically mental health programs aren't providing those services in the home, mental health services in the home. And so it increases access to those services and addresses some of the stigma that's related to seeking services at traditional mental health settings. And we've formed a work group, and we've done a lot of planning to put our project model together. I think we finally have developed that project model, including outlining our roles and responsibilities for our partners, and we're currently seeking funding. And so we've submitted a proposal with the Cambia Health Foundation, and then also planning on submitting one with the Meyer Memorial Trust.
John, you're describing this as the process, and then you would go to clinics to have nurses go out to the homes. Is that what you're talking about? Or
Public health.
I beg your pardon?
Public health.
So there's
Going to public health.
Public health nurses that do home visiting programs.
Are there that many public health home visiting programs?
Babies First, Cocoon, I mean, the ones that are listed there, most counties have those and are out for that.
So initially, the idea is to focus on public health home visiting programs, and if we're successful, we'd like to expand it. Ultimately, if it's successful, we'd like to do it throughout Eastern Oregon, but also expand it to other home visiting programs outside of public health, so like DHS or Head Start home visiting programs. There's other nonprofits that do, community-based nonprofits that do home
That's what I
visiting.
was wondering. Thank you. We have a few more minutes. Does anyone from Senior Center or from any other entity have updates that you think we should know about?
We're getting our ODOT audit in May, and follow-up, excuse me, the follow-up from our very first audit, so we're taking care of all the things that we suggested that we do. Our concrete mills is still going, our Meals on Wheels are still going. We need bus drivers, if anybody knows anybody that can drive the bus, let's volunteer for that. We only have 2 right now, so we could use a few more. So it's a job opportunity for somebody in the community.
All right.
I'm assuming they need a commercial driver's license, CDL.
I don't think they do. It's just, because the Meals on Wheels is, we have a Jeep that they take.
Oh, okay, I thought you were talking about passengers.
Yeah, well, we could use that too, but
Okay.
when they're using it for the Meals on Wheels, they can't transport, so. Just have to pass a drug test and have a driver's license.
Thank you, thank you. Arvinder, our next meeting is when?
It's the second Thursday of every month.
You'll be gone for the second Thursday next month, so I have the deadline, so it'll be.
So we'll email everyone when the next meeting is, so that,
Yeah, so it should be on May 11th, but I and Christy will not be here, we'll be in Portland for the conference. So let me send out a mail to everybody and see when I can, coordinate meeting.
okay. Any other issues that we need to bring up? If not, thank you very much for your time.
Thanks,
Thank you all that have traveled long distance.